A tracheostomy tube is a device which is inserted into the neck. It helps a person breathe or clear respiratory secretions. When a patient no longer needs the tracheostomy tube, the medical provider may decide it is time to remove the tracheostomy tube. This process is called decannulation. Join me this week as I discuss the requirements for being a candidate for decannulation, preparing for decannulation, and the decannulation process. Decannulation is the process whereby the tracheostomy tube is removed once the patient no longer needs it. This occurs when the initial indication for the tracheostomy no longer exists. The requirements for decannulation vary slightly from medical center to medical center and from doctor to doctor. In general, a patient is considered a candidate for decannulation when the following conditions are met. The patient is alert, oriented, and responsive to commands. The patient is no longer ventilator dependent. The frequency for tracheal suctioning is less than once a day. The patient is able to maintain his oral secretions without the risk of aspiration. The patient is able to cough and clear his tracheal secretions. For children, a microlaryngoscopy and bronchoscopy should be done to make sure the child's entire airway from the nose down to the lungs is open and unobstructed. Once the criteria are met, the process for decannulation can begin. The first step is to decrease the size of the tracheostomy tube. For adults, the tracheostomy tube should be downsized to a size 4. For children, the tracheostomy tube will be at least one size smaller than what the child is currently wearing. With the smaller tracheostomy tube in place, if the patient is able to breathe normally, a tracheostomy tube plug or cap will close off the tracheostomy tube. When occluding the tracheostomy tube, the patient should be closely monitored for respiratory distress or the need for suctioning. The amount of time the tracheostomy tube is closed off should be gradually increased. The cap should always be removed if there are any signs of breathing difficulties or if the patient is unable to cough or clear secretions. When the patient is able to have the tracheostomy tube occluded for 12 hours, then the patient is considered for the decannulation process. The removal of the tracheostomy tube is a 2 to 3 day process and involves plugging the tracheostomy tube overnight. Since this can be a dangerous process, the patient will require close monitoring by medical staff. For this reason, the decannulation process should be done at a hospital. During the first night, the tracheostomy tube is capped while the patient sleeps. Heart rate, respiratory rate, and oxygen levels are closely monitored. The medical team will also assess the patient for restlessness, excessive sweating, and the ability to clear secretions. If the patient has no difficulties with the overnight capping trial, then the tracheostomy tube is removed the following day. The stoma is covered with gauze. The patient should be observed for another 24 to 48 hours to make sure the patient is able to breathe comfortably and is able to cough and clear respiratory secretions. A gauze dressing will cover the hole in the neck, which is called a stoma. Without a tracheostomy tube in place, the stoma will naturally close on its own. For the stoma to completely close, this may take up to a few weeks to occur. In a minority of patients, the stoma has to be surgically closed. Thank you so much for joining me. Please remember to like and subscribe down below. I hope you have a great day and a wonderful week. Bye-bye.